Okay. Can everybody hear us right now, Armando?
Is what?
Has everybody who is signed in, can they all hear us?
Can they all hear us? I hope so. Can you all hear us?
Oh,
Yep.
okay.
Yes, loud and
Okay.
clear.
Yep, we can.
Okay.
Yes.
Yeah, we'll wait a few more minutes because
Yeah.
people are starting now to come in. Right. We're growing.
Hey, Sue, quick question. Do you get the pop-up that says admit?
No, I do not.
You do not. Okay. Because I was hoping that you would, and then you can admit people if I'm talking.
Right. Yeah.
Marty,
Armando,
what's that?
if you want to make me co-host, I could do that, I think.
Yeah,
Yeah.
absolutely. I can do that.
Great.
So let me do that. Your name is Vanda, right?
It is.
Okay, no, I just. You should
Still is.
you
Still
should be
is. I
able.
haven't changed it yet. Yep,
All
here we
right,
go. I'm bringing him in.
see if you get any admit now,
I do, and I'll
and you can
start
admit
working
them
on it.
all. There's a top button that admit them all.
Done. I'll keep an eye on it.
Terrific. Thank you very much.
You're welcome.
Armando, let's give it one more minute and then you can kick it off. Hi, Susan.
All right. Well, it's 103. We could wait 105 probably. Yeah,
Yeah.
and then we'll start. Okay.
It's great to see everybody.
Yes. Susan Burke, you are mute.
Good to see you guys.
How you doing?
I'm well. How are you guys?
Good.
Terrific. Terrific. You know, Armando, something we didn't put a slide in that says, Q&A. We'll have to try to see if we can, leave some time for some questions at the end. And I would also encourage everybody who's already online to, type in questions. And if we don't get to them, we will respond.
Yeah.
Your input will be important. Hi, Lee. Good to see some new faces and old faces.
All right, I think we're on.
Right.
Right? Let me share the screen here. Of course, it helps to turn your phone off.
Yeah.
Okay. All right, can you see my screen?
Yep.
Very good.
Just real quick check. Am I online? Bill Smith? You are, Bill.
We can't see you, but you are on.
We can hear you.
Okay, let me see if I can get that far. Thank you.
Okay. Well, welcome. All right. Well, good afternoon, everyone, and welcome. For those of you that don't know me, my name is Armando Nahum, and I live in Atlanta, Georgia. Excuse me. I am one of PFPS US founding member. And Project Pivot, as you see it on the screen, stands for Patients Involved in Developing Outcomes Together. And it's a collaborative initiative that enhances patient safety, diagnostic safety, and healthcare equity. By focusing on the experiences and outcomes that matter most to patients, families, and communities, Project Pivot aims to learn directly from patient-reported insights. We believe this approach prioritizes patient-centered perspectives to drive improvement in care, making healthcare systems safer, more inclusive, and responsive to the needs of those they serve. We would like to extend our deepest gratitude to PCORI, which is the Patient-Centered Outcomes Research Institute, the Gordon and Betty Moore Foundation, the John A. Hartford Foundation, and the Jewish Healthcare Foundation for their invaluable support of Project Pivot. Their commitment empowers us to prioritize and learn from patient-reported experiences, fostering patient safety, diagnostic safety, and healthcare equity improvements. With their support, we can place the needs and voices of patients, families, and communities at the forefront, making meaningful strides toward a more inclusive and responsive healthcare system. Sue?
Great. Let's go to the next. So the overarching goal of Project Pivot, and let me say, for those of you, I see a lot of new names in this group, which I'm delighted to see. And if you want more information on Project Pivot, the background, our concept, our processes, we have a webpage that you'll see at the end of the presentation. But our long-term goal for Project Pivot is to integrate new survey questionnaire items on patient safety, diagnostic safety, and discrimination and bias into national standardized surveys that assess our care, such as HCAHPS and PROMS tools that are used in research that have been identified and prioritized by patients. So we would like to see our national surveys that assess research, assess our care, on which payment is based, and other issues. We want to make sure that those questions in those surveys are questions that are meaningful to patients and families, especially those from marginalized communities, around safety, diagnosis, and equity. You can go to the next one. So this is a visual about Project Pivot. You can see over in the left-hand corner, phase 1 is to build community and learn from patients, especially those from priority populations. What are the experiences and outcomes that matter most to them regarding safety, diagnosis, and equity that they would want to report via surveys? So the second phase is really a collection phase. And this is where we're collecting proposed survey questionnaire items from patients and stakeholders. And we're also collecting existing survey questionnaire items that already exist in validated tools. Now you can see phase 3, that's when that mapping, organizing, and prioritizing. And then the phase 4 is to publicize and mobilize. But for today, where we are in the project is we are in phase 1 and phase 2. So today we're really going to talk about phase 1 and phase 2. If you have questions about phase 3 and 4, please ask us. But we're really going to focus on these two phases because this was the kickoff, in September, and we are deep into both phase 1 and phase 2. You can go to the next slide, please. So just a little, Marty, you're going to kind of cover the launch of Project Pivot and some of the other activities that took place in September.
Sure. I'll do this very quickly. We launched Project Pivot in conjunction with a DC summit built around World Patient Safety Day, which is September 17th. And we had to approach this with a fair amount of intentionality because Project Pivot, for example, is funded by organizations that don't fund advocacy, where some of our other activities during this weekend, this early week, were advocacy activities. And we also wanted to hear from government leaders who sometimes can't participate in advocacy activities. So we approached that, as best we could by keeping the events really distinct. But there was terrific synergy and overlap. And Sue just, I think, showed one. I mean, one of the things that Project Patient Care US was, Patients for Patient Safety US was established to do was to reprioritize patient safety because we thought that there had been drift. And nothing really speaks about prioritization other than a White House event. I mean, it was a high priority there. Project Pivot was recognized as an important contribution to the National Patient Safety Agenda. We also had a real interest in seeing the connection strengthened between equity and patient safety, and Project Pivot does that because of our attention to certain populations that are more at risk. A big part of our work is asking the government to help us see the harm better. Project Pivot will help us do that because the questions that we're going to come up with are going to help us increase reporting from patients about outcomes and experiences that matter to them. And then the theme for World Patient Safety Day this year was diagnostic safety. So again, we see a really clear connection between the advocacy work we did on diagnostic safety and the tool that we'll be creating with Project Pivot that will actually have the potential to improve diagnostic safety, or at least gather better information that will help us improve it. So it was an exciting 3 days. We were very busy. Thank you for your patience in sometimes having to run from one event to another. I know many of you had to do that, but it was, I think, a really great launch, situated in a really great kind of high-level, visible activity around patient safety and health equity.
Thanks, Marty. We can go to the next slide. Oh.
Yeah.
And something that Marty mentioned is that Project Pivot was recognized by the White House. They put out a press release, and they're really acknowledging the fact that we are using the whole of society approach. And so I just want to let you know, like, who was in that room. When we kicked off Project Pivot on the first Sunday night in DC, there were over 120 people there. We had HHS agencies there, all of the HRQ, CDC, CMS, the Office of Inspector General. We had healthcare systems there. We had patient safety organizations. We had industry. We had professional societies around infection in the emergency room. We had patient organizations, consumer organizations, community organizations. We had clinicians. We had nurses. And it was just a really lovely collection of people who gathered around this concept of creating patient-reported measures that really matter to patients. You can go to the next slide, please. So what did we learn? And this is, so many of you were there, so many of you weren't. But this launch was really to learn that phase one of Project Pivot, and that was to learn from the patient community what were the experiences and outcomes that mattered most to them, that they would want to report either to governments, to healthcare systems, to providers, to PSOs, to any authoritative figure or organization that can help improve care. So you can go to the next slide. We actually had small group discussions about a variety of issues. But before we even came to DC, we did an appreciative inquiry project with the attendees that were coming to DC. And we simply asked the participants coming to DC and participants while we were at the launch of the event, what does success look like for Project Pivot? So we bucketed the responses into 5 main themes. So this came from the participants. There were 52 responses. But it was interesting to see what the responses were. Success looks like creating an enduring, committed community throughout the project and after the project. So an enduring community that will go into other projects related to Pivot. The establishment, we're establishing a new way to create patient-reported measures. It's a patient-centered model with an equity lens. The adoption and, success would be the adoption and integration of Project Pivot survey questionnaire items into standardized tools such as HCAPS and other PRAMs and PROMs, used in research. And some even said success would look like development of an entirely new survey tool, and they even gave a time frame of 3 years. Success also looks like new knowledge and calls to action and policies that result from the new survey questionnaire items or the new survey tool that unveil areas of weakness. And then, of course, success looks like long-term better outcomes and experiences, including reported feelings of trust and safety that I thought was really interesting, and the overall reduction of harm, bias, and discrimination and diagnostic errors. So that came from our community. Many of you are on this webinar, and so let's all aim for those success factors. We can go to the next slide. So during the actual workshop, we had about, I think it was around 55 to 60 people. About 41% were patients and patient organizations, and the others were various other stakeholders. And we really spent the day really exploring what were the experience and outcomes that mattered to the patient family members, but also to the non-patient stakeholders. What would they want patients to report to improve patient safety, diagnostic quality, discrimination, and bias? And we also included a topic of transparency that we actually learned even before our workshop that was important. So we broke into groups, and we had, we looked at what are the experience and outcomes that mattered to all of the participants regarding patient safety, diagnostic safety, transparency, and discrimination, bias, and stigma. And then we also had several rounds of discussions about priority populations. So in Project Pivot, we are focusing on that. We have a special focus on birthing people of color, people with disabilities, older adults, and those who receive care in the ED. So we went through discussions. We used Slido, and we had work on flip charts, and we've distilled all of that. We can go to the next slide. We've distilled all of that into these themes, and I suspect that more themes will surface as we work together over the next year. But one of the most, I would say, one of the strongest themes that came forward is that, patients, patient organizations, and our stakeholders who are not patients want to know what is the physical, emotional, psychological, and financial harm to patients and families and how it impacted them. Patients and families want to be able to share this. Events that led to the harm or near miss. They want to be able to tell their story. And quite frankly, those who use PREMs and PROMs and HCAPs and other tools, they also, many of them said that they want to hear exactly what happened. Patients want to report bias, discrimination, and stigma due to race, ethnicity, gender, disability, weight, disease, age, and other factors. Patients want to share being dismissed, ignored, disregarded, disbelieved, stigmatized, and disrespected. They want to report timeliness and accuracy of diagnoses, triage, and treatments, and what caused those delays, be it the failure to report malignant pathology, the failure to triage in an appropriate, timely manner in the ED. Patients want to report how a harm event or a near miss was managed and communicated by the healthcare system, such as candor, and was there an apology? Were patients able to contribute to improvement processes? I thought this was an interesting bucket. The patients want to share if they felt safe. And I would say this was really prominent amongst our priority populations, but they wanted to feel safe, as well as that they are getting care in a trustworthy healthcare institution. There was quite a bit about inadequate patient education support. And interestingly, well, not interestingly or surprisingly, but how they felt like they were not informed how to escalate care when their family members or themselves were deteriorating. And they also didn't feel that they're involved enough in the discharge planning. Several comments about continuity and coordination of care between providers. Patient and caregiver engagement and decision making. Several patients said they were not included in decision making or informed consent. That they wanted access to their medical records. They wanted to be able to change their medical records or correct their medical records. And they also wanted to be able to add information into their medical records. They also wanted to make sure that they were getting access to their medical records without delay. So kind of tapping into that 21st Century Cures Act. Patients wanted cultural and linguistic competencies, accessibility and accommodation for those with special needs, including the special needs of adult or older patients. Patients wanted to report cover-up and of medical error and lack of accountability. And also patients wanted to report that they were informed or not informed of how to report patient safety incidences. And so this is very high level, but these are the buckets that we've identified, and we'll be drilling down into all of those buckets, because all of those buckets will eventually hold several individual potential survey questions for HCAHPS and PROMS and PREMS tools that address these particular themes. So this is really what not only the patients, but the non-patient stakeholders really kind of coalesced around all of these. We didn't see a lot of, wide variations in these experiences and outcomes. And actually some of our, like our HHS and some of the healthcare systems wanted to be able to ask questions in these survey tools of, they would love to hear from patients and what do the patients think that would have improved their care. So they want to learn more from the patients, not only their experience and their outcomes, but in their perception, what could have improved their care or led to better outcomes. So I thought that was interesting. We can go to the next slide. Hey, Vonda, you're going to step in now and take us through some Slido questions.
Yeah, I think Armando and I are going to do a little from different states. Let's just start with a simple question. We'll have 3 Slido questions today, and these are similar questions to what we have asked before. So today, all of this input will get added to that input, and this is just another iteration of making sure that we're pulling from patients and from that perspective to make sure that we're hearing from you. So if you can use your phone, you can point to that QR code if you haven't already with your camera, and that should then create a little yellow bar. If you've not done this before, I'll monitor the chat, and I think Marty's monitoring the chat also. And we're coming in from all different places, and it'll show us when we have multiple places. We have 4 people from Maryland and Illinois, 5 from Illinois. We'll keep going until we stop seeing that number grow. There are about 50 of us or so here, and we're about halfway there. So let's just see how many places we're coming in from. And if you are having any trouble participating, please let me know in the chat. Great. Looks like we might have tapped out around 32. That's okay. We're going to go ahead and move on to another meaningful question. When you're ready, Armando, you can take it. So just like we've asked before, in Washington, D.C., and also in the email poll, we asked these questions in each area. Here today, we're combining them into one. We really want to hear from this assembly what 3 experiences or outcomes are that you would like to make sure are reported, that you would like to report, or you would like to have patients be able to report to providers, healthcare organizations, government agencies, and others. And so here, I see New Mexico came up here. That's probably just a delay from the other one. So, um, and this might take some time. So give us some thoughtfulness. We have time today for you to really think about those 8 categories that Sue just mentioned, or any other categories that are important to you. And you can go ahead and do them separately. You can go back in and add another. You do need to make sure and press enter when you're done. And we have another person coming in, so I'll just orient them to where we are. Jerry, welcome. And we're in the middle of a poll. If you want to grab your phone and scan that QR code, we have about 50 or so folks here today answering the question, what are 3 experiences or outcomes you would like to report or be reported by patients to providers, healthcare organizations, government agencies, or others? And here again, we're seeing some themes around communications, noting when there's discrimination. Continue to take your time with this. We have about 10 people who are currently typing. Sue, I'm seeing definitely some of these
Yeah.
themes that were
Definitely.
brought up before showing up again. I'm really appreciating, as a patient activist myself, just this process of gaining a lot of input before we start to narrow it down
Right.
too far. Welcome. If you just joined us, we're in the middle of a poll. If you want to aim your camera on your smartphone to that QR code, you can join us. We have about 6 people who are still typing, and then we'll probably close this, and we'll go to one more poll before we close. And if you've already started to answer, if you've already inputted your answers, I'll give you a little heads up for that next question. It's going to be, we're going to be asking us to narrow it down to just the one. What's the one most important question? And that'll be coming up here in the next poll. Thank you to those last 3 participants who are giving it their thoughtfulness. There's a lot around discharge here, Sue. I don't think we've called that one out as a specific, but I'm seeing a lot of that come up today. Right, we'll just give it about another minute here. If you're typing, go ahead and finish it up, and then we'll move on to the third and final Slido poll question today.
Mhm.
Handoffs too. I'm surprised handoffs hasn't come up more in
Right.
previous data. I'm definitely seeing some new pieces, some new
Right.
perspectives in here
Yeah.
today,
Yeah.
which is
And I think there's some, some length, because some people call it coordination of care, some people call it continuity of care, some people call it handoffs. So I think you have to kind of drill down on some common language and
I'd
yeah.
almost like to see a next iteration of this turn into some questions that we ask our providers when we're in the
Yeah.
room, like little,
Mhm.
I think
Yeah. There's
I
so
always
much,
ask about the
that you can
handoffs.
learn, and Vanda, thanks for pointing out, this particular exercise that you're participating in, is what we did during DC, that we've done since DC, and we will remember we're at phase 1 and phase 2. We will continue collecting this data and analyzing it and putting into buckets until the end of this year. So phase 1 and phase 2 of collecting from you, I mean, you are the source of information for this project. you are driving this project by, your input that we hope to continue over the year. And then once we compile all this information, then we're going to start after the new year, we'll start getting into small virtual groups. We'll be doing surveys, we'll be doing focus groups, and then we'll start distilling. Remember that picture of the funnel? We'll start distilling and prioritizing with the patient community.
Okay.
Great.
Armando, we'll give it just everybody, if anybody's typing, go ahead and finish it up and press send. Even if it's midstream, we'll catch it. We do a little bit of fill in here sometimes.
Yep.
You can kind of tell where something was going at the end of a poll.
Right. And it's so gratifying to see, there's a lot of what we learned in DC and what we're learning now. There's a lot of I would say hunger by many of our patients and patient organizations to finally be asked these particular questions, to let them first kind of blue sky and kind of set the stage for this project.
Okay, Armando, let's go ahead and go to the next slide, please. And here, just like we did in this most recent email query, as well as in DC, we asked, and we're asking this group today, what is the one question that you would most like added to the HCAHPS survey? What is that one question that you think, if you had to just choose one to rise above? This helps us as we're looking through all of the inputs from the various sources, and will continue to do, as Sue said, through the rest of the year, distill down around priorities. Yeah, Lori, I just saw your note in the chat there. It really does make a difference to have that patient perspective centered in the formation of these questions and our focus points. Mm. I think one of the most common questions that has come up over the last month in these polls is just the simple question of, did you experience harm? And even in asking that question, it can educate us in the hospital as patients and family members when we see that question. We have about 3 people who are still typing, and then Armando, I think we'll go ahead and continue on.
Okay.
And thank you everyone for participating in this poll. All right, is it back to you, Sue, or Armando?
Yep, I think it is me. Okay,
Yes.
so the question, what is happening next? And again, thanks for taking your time and thinking about those questions and your answers. That is, again, going to be moving this project forward. So as you see in this timeline, the far left, where we're building community and learning. And I want to stress that, the patient community is never closed. And so we are continuing to get new patients, new patient organizations, new stakeholder groups. And so for those of you on this webinar who are not yet part of Pivot, Armando's going to walk you through at the end of the webinar how you can become. We do have some healthcare systems. We'd like some more healthcare systems. So June through January, or June through January 2025, we are going to continue building our community, and we are going to deploy surveys to patients, the patient organizations, and others to collect this information that we've collected from you today. Also, phase 1 and phase 2 are kind of taking place at the same time, but what we're doing is, not only collecting questions from you, but we're also collecting existing validated survey tools from around the world. So that when we collect everything from our communities and we start distilling them, what we are going to do is we're going to crosswalk what our community is saying they want on these national surveys, and to see, are there already existing tools with questions that we could potentially use? And so, Lori Zipper, I see you're here with us. We have Lori Zipper is a medical librarian who's joined us, who's doing a literature search. We've also reached out through the WHO listserv, and we've had calls for input into to submit prems and probs and other potential survey questions. We have collected quite a bit of existing survey tools. We have received them from Australia, England, Estonia, Saudi Arabia, India, Canada, Spain, the OECD, many from the United States, and we have collected several individual survey questions. Preskeni submitted quite a few, and so we're creating this incredible compendium that eventually we will crosswalk with the questions that this community comes up with. Then in phase 3, so after the new year, we are going to try to have another in-person meeting and in DC. And so we're in the process of, trying to organize that and fundraise for that. Then we will be developing our second surveys. Remember, our first survey was asking what are the experience and outcomes that matter most to you. Our second survey is going to really drill down after we have this opportunity to really look at our compendium and crosswalk them. Then we're going to start really focusing on those questions that we want to see, both prems and experience and outcome measures that we want to see on these national surveys. And so we're going to develop a survey tool and deploy that through patient organizations, patients, as well as healthcare systems. Now, I don't know if IHI or if Divvy's on from, I'm blanking, Divvy's organization. Help me out. Healthcare system. But healthcare systems have agreed to deploy a survey to their patient experience leaders, to their quality improvement leaders, and some of their clinical leaders to ask them what are the patient reported questions on HCAHPS and other tools that they would like to see the patient's answer to help them improve. Geisinger, thank you, Marty. So we'll be doing, really surveying the patient community through focus groups, through surveys, through, we'll be using social media, and then the healthcare systems will be doing the same, but getting the perspective from the QI, patient experience, and clinical leaders, like what do they want to see on these surveys to help them improve safety, diagnoses, and reduce discrimination and bias. So we have a variety of engagement mechanisms that we'll be using January right up until next September, when we're going to have our final prioritization and a project closure meeting. And then after that, we will disseminate the findings, partner with organizations that can help advance those survey questions that we're going to identify and prioritize. So we'll be partnering with many of our current partners. And then also we'd like to partner with organizations to help develop those new survey questions that don't exist yet. And that will require quite a bit of development and scientific validation and development. So that is a longer term project, but we are really looking at that partnership opportunity, throughout the lifetime of this project and then beyond. So that is the timeline and activities. Now we can go to the next slide. And I know that we received lots of requests from some from individuals, some from healthcare systems, some from researchers, like how can they participate in Project Pivot? And there's a variety of different levels. Whoops, can we go back? Oh, I think I skipped something. I just want to show that in that timeline, it didn't show that we have been invited to present at IHI on Project Pivot. And while we are there, we'll be doing similar exercises with their quality improvement, patient experience, and clinical leaders all at IHI. So we'll be polling them on some of those same questions. What questions do they want to see come, on those surveys that come to them to help them do a better job? And we're also now, Marty, I don't know if I even told you this, but we've also been invited to be featured in the Innovations Lab at IHI as well at the same event. We can go to the next slide.
Well, a quick question here that someone may be pondering about. I thought I jumped the gun a little bit here. You talked about phase 1, build community and learn. Is there a timeline for people to join our community, or is there a cutoff once we get to phase 3 and 4?
Right. Well, that's a good question. I would say once the patients start prioritizing like especially the final prioritization towards the end of phase 3, then we probably will stop taking new questions. And the partners, I think the partners could join, but they won't be participating if they're not patients. They won't be participating in the prioritization. If they want to join Pivot just to participate and learn from Pivot, they're welcome to do that. And I think that some of the partners that might join even later on, that they might see an opportunity to partner with PFPS US or Pivot in projects that, down the road. So I would say that we would welcome new partners at any time, but when it comes to the actual prioritization, it will be done by patients.
Great.
And we will welcome patients into the group. Yeah. Okay, so this kind of answers your question, Armando, or addresses it. The role of Project Pivot partners and collaborators. And, a lot of our champions, PFPS champions said, how can I be engaged as an individual? Researchers have reached out, say, how can I be engaged? So if you look at this first, the purple square there, as individuals, all of you can answer the surveys, and you can share the surveys with your respective communities. You can put this on social media, which is already happening. And so I just want to share with you that the survey, we have a survey tool that's currently, I don't know if it's active, Vonda, but we're going to reactivate and shorten some of the survey. And we're going to make that live again until the end of the year. So we will let you all know when that survey is ready. We're calling that just survey 1. And in the new year, we'll have survey 2. And who knows, we may do other surveys, but, reaching out and collecting information for this project will be essential. Submit proposed survey questions on the Pivot webpage. Now, Armando's going to show you at the end of the webinar how to do that. If today we had ideas, we'll have other surveys, but if you come up with a question, say, hey, I want to submit this question for consideration, then there is a place on our website that you can submit that, and we capture that. Research, especially researchers and maybe healthcare organizations, if you are familiar with existing validated PREMS and PROMS tools and other questionnaire items or scales, you can submit them as well. And Armando's going to show you how and where to do that. But this has been extremely helpful to us. Many of you have, and many of our international colleagues have submitted validated PREMS and PROMS and other questionnaire items for us to consider as we go through that prioritization process. Another opportunity is if you or your organization wants to offer informational presentation on Project Pivot, we can prepare and provide you with a slide deck. Or if you'd like us to present at your organization, we are happy to do so on Pivot. You can provide us guidance on feasibility of proposed survey questions and potential barriers. We have researchers, we have CMS, We have CAPS people, we have measure developers that can give us guidance on what survey questions might be more feasible and implementable than others. We are going to reach out to many of you to help plan, lead, and participate in meetings, virtual and in person. You can serve as liaisons to your communities, healthcare system leaders, and members to collect input. Again, this is, we're going to be collecting a lot of input. You can contribute to the creation, distribution, and analysis of surveys and focus groups, etc. Because I know some of our patient groups said that, like AARP, I think, I don't know if you're on, but you mentioned that with the older adults, you do better with focus groups. We know some of the younger patient groups want to reach out via social media. So we're going to really try to adapt some of the engagement mechanisms to the appropriate populations. We need help in identifying and writing new grants and pursue scholarships for patients and families for our next year, our 2025 in-person meetings. And, when the project concludes, disseminate the project finding and help advocate for uptake of our project outputs. So this is kind of a menu of picking and choosing at what level you can be engaged or want to be engaged. Going forward, we're going to be reaching out, especially our research. We have some research advisors who I think some of you are online. Start bringing their expertise into this project more, along with some possibly the creation of an advisory group, but really to ensure that we're capturing and distilling all this information in the most appropriate way. And go to the next slide. And Armando, this is you.
This is me. Okay, I'm going to go through this fairly quickly so we can have time for Q&A, right? So how do you get engaged in Project Pivot? Well, joining Project Pivot, it's easy. If you're passionate about improving patient safety, diagnostic safety, and healthcare equity, we would love to have you involved. You can visit pfps.us/project-pivot, as you see it on the screen. And there's a sign up button in there and become part of our community. By joining, you'll have the opportunity to share your insights, contribute to meaningful change, as Sue was mentioning earlier, and collaborate with other patients, families, and healthcare professionals and advocates. So whether you have, personal experiences to share or are committed to advancing just patient-centered care, your voice does matter in shaping outcomes, and that will prioritize what's most important to patients and communities. We also invite you to take part in our survey, as I believe Sue mentioned earlier, on patient-reported experiences and outcomes. Your feedback will help shape improvements in patient safety, in diagnostic safety, and healthcare equity. The link is slido.com/244-6000. And we'll place that in the chat in a minute. And you can participate and share your valuable insights there. Also, as Sue mentioned, feel free to share this link on social media so that it will help us reach more voices, and together we can make a difference. If you have existing PREMs, that's patient-reported experience measures, or PROMs, patient-reported outcomes measures tools, or any other questionnaire items that could support our mission, we'd love for you to share them with us. And you can visit pfps.us/Project Pivot again, and there's a form in there where you can submit these. Your contribution will be absolutely instrumental in helping Project Pivot capture meaningful insights from patients, families, and communities to improve healthcare outcomes. So thank you for being part of this important work. And finally, last but not least, you can become a sponsor for future meetings. You can support our mission by becoming a sponsor, Project Pivot, and sponsorship can really help us bring together patients and families, especially when we hold in-person meetings. It gets fairly expensive, and we love your support. Again, pfps.us/sponsorship. to learn more about the sponsorship opportunities. We have several ones in there. So thank you again for considering a role in driving this essential work forward. And now I think we can open it up to some Q&A.
Yes. Any burning questions, any comments, any thoughts how to improve this project? I saw one of the questions about from Ann Peterson, how it's so important to collect from really diverse groups, and something that maybe we should have done, but Ann, we didn't, and I could give you more information, but we've got, that is one of our biggest aims, is to really reach diverse patients and patient organization, community organizations. We have a variety, we've got people with HIV/AIDS who experience stigma. We have a Korean group from Chicago. We have birthing people of color groups. We have, 4 or 5 different disability groups: Down syndrome, autism, physical disabilities. So we're really trying to, we have AARP and older adults. So we're really trying to dig down and really reach out to a variety of groups so that we can authentically say, this is the voice of the patient and the caregiver. And that what we're doing is representing, those perspectives. Lori, I see that you asked a question about, will there be user testing? And this phase of Project Pivot is the output of this is just that we're collecting and prioritizing potential questions based on what matters to patients. And so we are not testing it. And that might be, Pivot Part 2. But this is the first step, probably in many steps, that this is simply that our output will be lists of potential survey questions that patients have identified, both existing, and those that do not yet exist. And then we'll have priority population specific questions, and also identifying those that exist and don't exist. So we will not be testing at this point, but at some point we see that as being another project. Any other questions?
We have Karen Fernandez.
Okay.
Just got my audio on. It was a little tough. The Joint Commission has had standards around this for evaluating patient safety and quality. And a lot of organizations have used the AHRQ tool. Do you know of any other tools that have been more predominant for hospitals to use?
Marty, maybe you could, are you suggesting, are these the tools that the healthcare systems are taking themselves on, like the culture of safety?
Yes.
Oh, okay.
Yes.
Honestly, I personally am not familiar with any other tools per se. Now, there might be globally. It's certainly something that we could put out there on, because we're very connected with the WHO's Global Patient Safety Network, where we post questions. And we could certainly ask that question about specifically the culture of safety.
Right.
And other questions, other survey tools that might identify better a culture of safety.
Okay.
So that's a really good question. That's a really good perspective. Yeah, it's almost like we need to go through the culture of safety tool like we're doing with HCAPS and other, proms and prems.
Right.
Oh,
Thank you.
Yep,
Yeah.
thank you. Nadine, you want to go next?
Yeah, 2 quick things. I haven't had whether I should say this, but will we, as a consortium here that have come today, automatically be invited to your next meeting, and will they be monthly or bi-monthly? Or?
Yeah, and yes, you will be. Everybody on this distribution list will be invited to attend all of our webinars. And
Wonderful.
Yeah, absolutely.
Okay.
And,
I have one other point to make, and I was drawn to your acronym just for the word alone, let alone what the acronym means, because I'm on some safety committees, and one thing that I push other than pressure sores, which is probably number 2 on the CMS metrics, is the number 1 metric, which is falls, of course.
Yeah.
And it seems to be repeatedly the number 1 measure.
Right.
And the thing that I keep pushing from a patient perspective is learning how to pivot. And if you don't go home and really know how to pivot, I just love that. I was so drawn to it just for that reason alone.
Well, that's great. That is great, Nadine. Thanks for sharing that. And,
Thank you for having me.
Yes, and as we go forward, invite all of you to webinars, and we intend to have them monthly, and we intend to share what we're learning along the way and ask you for more input. And so, we're hopeful that after this round of capturing, what is that one HCAHPS questions? I mean, there's a lot of curiosity about what we're learning, and we want to package that and share that with you. It doesn't mean it's final. But we want to bring you all along and share what we're learning along the way.
Yep. And you're next. You're mute.
Mute.
Hi, good afternoon, good morning.
Hi.
Thank you so much, Armando. I think my question has been addressed by Wanda. Thank you so much, Wanda.
Well, Vanda's just ahead of the ball game.
Yes, it's about being anonymous if there are responders, potential responders that we approach
Yeah.
and they ask a question, then we might be able to provide that information. Thank you so much. This is really, really great.
You're welcome. We have a question from Lori on if for those people that cannot attend the in-person meeting in February in DC, whether we will have a virtual setup for that. And,
Yeah, well, yeah.
And the answer is
Yes.
yes, we will. Yes.
Yes. The answer is yes. And we really wanted to do that in September, and it just didn't come to fruition. It was but we recognize how important that is forward to engage those who can't travel in all of our process.
Yeah. Karen, did you have another question?
Yeah, I had one more question. Tomorrow I have a meeting with the Joint Commission for their consultants forum. And would there be any question you would like me to present at our committee meeting tomorrow?
Yeah, I would love to have a Joint Commission involved in this project. Absolutely. I watched Jonathan Perlin and Dana from the National Quality Forum. They hosted an online chat, and they talked about how important patient-reported experience and patient-reported outcomes are. So I would love to see Joint Commission step into this partnership because I think that they would be very influential, and I would think that the Joint Commission would want to know what patients are, wanting to report. So I would issue an invitation on behalf of PFPS US to join us.
Okay, I will. Thank you.
Yeah. Adam, you want to go next?
Yeah, I recall at least maybe 6 months ago, when this was just getting started in one of your meetings, I thought that NQF, at least, I don't know about the Joint Commission, had already been approached and Andor was on board with this, but maybe, did you say something about that, Marty or Stu? I can't remember.
Not that the Joint Commission. Now, the National Quality Forum is a partner of ours, and they did attend. Yeah, they were there in DC for the launch. So I think they maybe are like de facto representing the Joint Commission, but we'd love to see the Joint Commission itself join.
Yeah. Any other questions?
Hi, I do. I was actually typing it in the chat. I was wondering to maintain the perspective of a patient as we collect the survey responses, because many of us, work, have it as a professional background, but really to maintain that patient perspective. I'm curious if we ask them to maybe attest that they are a patient, had past experience, or know someone, their experience, so that they may be able to input that into the survey questions and not just, based on professional work.
Right. Well, that's a interesting question. I think that right now, because right now anybody can put survey questions, you know, that picture of that funnel, anybody, professional societies, industry, anybody can put questions into the hopper. But when we get to the beginning of next year, then it will be patients that we have identified as patients. And most of them come from patient organizations, you know, cancer groups, minority groups. And, you know, I haven't thought about like an attestation of being a patient, but it seems like the organizations with whom we're working, that they, you know, they operate with a level of integrity that they would put forward representatives who can really represent the lived experience, because that's really what we want, is lived experience. But that's a really good point. Yeah.
Thank you, Sue.
We are past the top of the hour. I think we have one more final question, and everyone else can always reach out to us if you think of more questions, and we'll do our best to respond to all of them. Jerry, you want to go next?
Sure. Yeah. Sorry, I missed the beginning, so I don't know if it was addressed, but I was just responding to somebody's note in the chat because I'm doing some work with the VA, and one of the things we're trying to look at is also the provider clinician experience, because it's so often undermined. And it seems like so many of the CAPS questions are kind of like judging the clinicians, but they're not often able to do their jobs well because of how the leadership is treating them. So I don't know if there's a way to kind of look at both sides, but we're starting to try and figure out how to do that and try and look at that bidirectional trust, which is so important, because
Right.
If a clinician who you don't trust is telling you to do things, you're not going to go home and do them. You're not going to be safe. So I just wanted to throw that out. It's something we're also looking at, and I'm happy to share some of the like health literate care organization questions and other types of questions that we've been looking at as well.
Yeah, and Jerry, you know, that has been brought up from the very beginning of this. You know, we've had some like suggestions that we broaden this to the clinician experience. This particular project is going to focus on the patient experience, just because that is what got funded. You know, that was our funders, we were very clear about what the scope of this project is, but we see the opportunity to do exactly what you're saying. But I think, Jerry, what you're bringing up is something important. We do not have many clinicians involved in this project. And as we develop the questions that would reflect their, performance, it would be good to have them engaged in this dialogue all along the way. And we actually are hoping to, we actually wrote a grant to bring in more clinicians by next year. We don't know if we'll get it, but we see that we see that as a real important group that needs to come under our tent. Thank you.
Okay. Well, thank you everyone for your time today. It was informative. We always enjoy giving these webinars because we're very passionate about this work. So I hope that you are as well. Thank you. Any last closing remarks, Marty, Vonda, anything?
Not really from me. I think it was a really interesting webinar. I learned something here, even though I'm on the leadership team. So,
we're always learning, always learning.
Yeah.
Always learning.
I'm just very interested in grabbing this chat. There were a lot of really good ideas in here about the process. So just know that if you put things in the chat, we'll be going back to it.
Oh, yes.
Thank you.
Yeah.
Now, just thank you all for coming. And, remember one of the, what does success look like? Number one was that we remain an engaged, thriving community throughout this project and beyond. So I just encourage you all to stay engaged.
Yeah. Thank you, everyone.